Established in the year 2020, the ESCP Global Reach Committee is committed to promote collaboration in research and also education among colorectal societies at an international and also global level. To achieve this goal, the committee had already organized 2 educational webinars and a scientific symposium within the ESCP annual scientific meeting last year. In these webinars, we were able to connect thousands of surgeons over the world to exchange scientific knowledge and also experience. Feedbacks from the attendees of these workshops and webinars were very encouraging. On 19th of March 2021, the ESCP Global Reach Committee is going to organize our 3rd educational webinar entitled Translating Evidence into Practice. Now, in this webinar, there will be 2 topics for discussion. The first is about the controversial management of asymptomatic primary colorectal cancer in the presence of unresectable metastases. And the second part of the webinar will be ESCP trials update. We have invited principal investigators of various international clinical studies to come to speak to us, to update us on their trial progress, and to share with us experience. I'm sure you will find the program academically rewarding and also useful to your clinical practice. I would like to welcome you all to join our ESCP Global Reach webinar on the 19th of March 2021. I'm looking forward to meeting you all online. Thank you. The 14th Scientific and Annual Meeting of ESCP in Vienna. Now, over the years, the ESCP has been very successful with increasing number of international members. The ESCP leadership feels that something has to be done to reach out to and to connect with all these global communities of colorectal surgeons and to facilitate the work of other ESCP committees such as Research and Education Committee in terms of international collaboration. Therefore, the ESCP leadership, you can see in this picture, Willem and also Dion, met with the presidents and chairman of a few Asian colorectal societies, that is the Chinese Society, Hong Kong, and also Korean societies, and decided that a Global Reach Committee should be established with these societies as the initial members. So the nascent Global Reach Committee was established. And the first teleconference of the committee was held on the 20th of January 2020. And initially, there were only 4 members, as shown here: Professor Yao from the Chinese Society, Dion from ESCP, myself from the Hong Kong Society, and also Professor Sukwan Lee from the Korean Society of Coloproctology. So we were the 4 initial members representing the 4 societies. So Professor Dion MORTON and I were chosen to be the first co-chairs of the nascent Global Reach Committee. And after the first teleconference, we have actually met about 10 to 11 times, also all teleconferences, to decide on the term of reference, the responsibilities of the committee, and also to plan ahead, different activities in terms of research and also education for ESCP.
Flagship Hospital, affiliated to Capital Medical University, is also the president of Chinese Society of Colorectal Surgery. Welcome, Professor Zhang.
Hi. Thank you, everyone.
And secondly, I would like to warmly welcome Dr. Dion MORTON, who is the Barling Professor of
where robotic will be a better approach. So I think it is an option, all right, depends on the situation, but TME is the standard.
I can have a comment.
Yes.
Can I have a comment? Yes. As a standard surgery, you have to operate on patients with very, very low risk for local recurrence. Then you can do the TME. You have to decide and select these patients. But for the very, very low cancers,
their support. Now we are starting our communication between West and East for the first time via
3 different countries. I hope you feel like we do, that it's exciting for us to benefit from the knowledge from these different continents and use that to benefit.
Good evening from China. I'm Dr. Hongwei Yao, come from Beijing Frontier Hospital. On behalf of Professor ZHANG, the President of Chinese Society of Colorectal Surgery, and on behalf of the Global Reach Committee of ESCP, I'm very honored to deliver my warmest greeting to all our dear fellow doctors all over the world. The Global Reach Committee stands for collaboration, dialogue, and friendship between surgeons from the West and from the East. Every quarter, we will have a Global Reach Committee event to discuss some hot issues in the field of colorectal surgery, and you are more than welcome to watch every event. I sincerely hope more societies will join this one family. Together, we will be stronger, and we will make this world a better place.
Dear colleagues, I'm delighted to welcome you to join us on this fourth Global Reach webinar that's coordinated by ESCP with colleagues from across the world. On this occasion, we're going to be addressing the complex management of the primary tumour in the presence of unresectable metastases, with presentations from colleagues around the world. In the second part, once again, we're going to discuss the ongoing research at ESCP, which you can collaborate in and be part of delivering. We really look forward to collaborating with you, and I do hope you can attend the webinar on March the 19th. See you then.